How do people get OCD? Like most psychiatric conditions, research indicates that there is no single cause of OCD. Instead, most experts agree that OCD is likely caused by a combination of psychological, socio-cultural, and biological factors. Psychological factors, or cognitive theory, it means thought processes. The theory focuses mainly on the thoughts in OCD instead of the behaviors. It is based on the idea that thoughts impact how we feel. In OCD, this theory suggests that people with OCD misinterpret their thoughts. It is not the obsession itself that is the problem, it is the way the obsession is interpreted. Intrusive and disturbing thoughts, for example, harming a loved one or leaving the stove on and starting a fire, are normal and common. Cognitive theorists have identified several patterns of beliefs that are common in OCD. They may contribute to the ways people with OCD misinterpret their thoughts. For example, overinflated sense of responsibility, it is the belief that you are solely responsible for preventing harm to others. Exaggerated sense of threat, it is a tendency to overestimate the likelihood of danger. Over importance of thoughts, people believe thoughts are very important and must be controlled. Thought-action fusion, just having a thought increases the chances that it will come true or that I will act on it. Perfectionism, people thoughts mistakes are unacceptable. Intolerance of uncertainty, it is a need for 100% certainty about a given situation. Social and cultural factors. Research on OCD in different cultural groups suggests that there are no big differences across cultures, ages, or between genders. Instead, OCD symptoms often seem related to the things we value most or that are particularly relevant in our lives. For example, obsessions about harming one's baby is common among new parents with OCD. Similarly, individuals raised in religious homes may develop obsessions that seem to contradict one's religious beliefs, for example, sexual thoughts about Jesus Christ. Behavioral theory. Unlike cognitive therapy, which looks at thoughts, behavior therapy focuses on the behaviors in OCD. According to behavior theory, OCD makes connections between certain situations and fear, for example, public bathroom equals anxiety. In order to reduce that fear, the person learns to avoid those situations or do rituals. A link is formed between compulsion and feeling better. The more someone avoids or ritualizes in response to this fear, the stronger that link becomes. The stronger this connection, the more likely a person is to continue their avoidance or rituals because they don't have to confront or tolerate that distress. Their avoidance or compulsions become reinforced, and the association may start to get triggered in other similar situations like bank machines or public handrails. Changes in brain chemistry. Firstly, neurons, which are cells in the brain. Secondly, neurotransmitter, which is a chemical in the brain that helps transmit signals from one neuron to another. Thirdly, serotonin, dopamine, and glutamate, which is naturally occurring neurotransmitters in the brain. Changes in brain activity. Positron emission tomography, PET, which is a brain imaging technique that produces a three-dimensional images of chemical changes in the brain. Single photon emission computed tomography, SPECT, it is similar to PET scans. SPECT is a brain imaging technique that can give information about blood flow and chemical reactions. Functional magnetic resonance imaging, fMRI, it measures brain activity by looking at changes in blood flow in the brain. Genetic factors in OCD. Tourette's syndrome, US, which is a neurological disorder characterized by tics. Tics are repetitive, involuntary, and sudden movements and/or vocalizations. In a minority of children, the development of group A streptocococcal infection, strep throat, has been associated with the onset or worsening of OCD symptoms. In these cases, OCD or US symptoms develop very abruptly after infection. Some scientists believe this may be an autoimmune response, where the body mounts an immune response by attacking the basal ganglia in the brain. There is currently no evidence that this, or other infectious agents, play a role in developing OCD in adulthood. Other possible causes. For some women, premenstrual and postpartum periods can lead to the development or worsening of OCD symptoms, suggesting that variations in hormone levels may play a role. OCD symptoms that develop quickly after a traumatic event have been observed in certain cases. This suggests that stress can contribute to the onset of OCD symptoms. There have been small studies showing that damage to the brain, such as stroke or traumatic brain injury, in certain areas can also give rise to new OCD symptoms. Thanks for watching. Please subscribe and comment for any questions related to mental health problems.